Okay, so we're looking at David, who's had a stroke that's affecting the right side of his body and affecting his quality of life and his activities of daily living. Now, David was a really independent person before the stroke, so this is really causing him some frustration in terms of his lack of mobility and his lack of ability to do the things that he always used to do. So we've designed an exercise program specifically for David. Now, there are protocols for exercise rehabilitation for stroke patients, and we've taken them into consideration. But what we believe is most important is that we treat David as an individual. And as such, we've looked closely into David's situation, and we've devised a group of exercises where the progression and the regressions that we apply will essentially be done according to how he feels and how he's managing the exercises as we go along. So one of the first exercises we're doing is going to focus on the musculature of the lower body, because that's essentially where we need to work to help him achieve his goal of functioning as best as he can day to day, independently without relying on help. So it's a really simple exercise. We're just going to do a squat, but we're going to provide David with as much support as he needs to reduce the risk of falls, and then he can self-adjust to progress that exercise or regress that exercise according to how he's feeling as the program goes along, and also how he's feeling on a day-to-day basis. So David, I'm going to instruct you to just stand fairly close to the wall and cross your arms over your chest and with your hands on each shoulder. Okay, so that takes them out of the equation essentially, but what you do have for balance is the wall. So we'll just apply some pressure in the upper body against the wall. You can also apply it through the hip, depending on how you're feeling. Now you will lift the left leg up and just get your balance there. So you're feeling quite secure. If at any time you're not feeling secure, just drop the foot. We don't want you to have a fall. So it's safety is top of mind at all times. Now, once you're comfortable here, all I want you to do is just to squat down really shallow to start with. To progress, we can squat down lower. To regress, we don't go as far. Also, if you're feeling really comfortable, you can start to reduce the amount of pressure that you're pushing into the wall, and that's going to increase the intensity of the exercise. So the idea is just you push down and then push up. And essentially in that concentric and eccentric phase, the combination of those, we're going to work all of the major muscles through the lower body. So David, if I can just get you to come over here and just stand as I said, perfect. Now just be sure to try and keep your posture, so we don't want to lean forward or back as we're going down. We want to just go down straight like you're sitting in a chair. So do you feel comfortable there?
Yeah.
Okay, now at any time if you're in pain or you feel you need to stop, just drop that left foot and we can finish. So now just lift your left foot for me, and now just bend your right foot down. Just keep your chin up just so we keep that spine in alignment. How does that feel? No pain?
No pain.
Okay, let's try a little deeper then. Okay, now as soon as you start to feel unsteady, you just stop and just make sure as you're going through that you keep your core really strong too, because that's going to help your balance. Okay, can you feel those muscles working?
Yeah.
Okay, awesome. Okay, well we'll progress David through that as we go through the program, and especially through weeks 5 and 8, where we'll test his balance a little bit more.